Dear colleagues, dear friends, good health to everyone. Today we have a unique lecture for you. It is connected to several projects at once. First of all, of course, it marks the release of the new human microbiome software module within the Veda Pulse functional biohacking system. And since the topic of the microbiome is very close to the area developed by the Wellness Biotica project, today we will certainly discuss the microbiome in various biotopes in greater depth. The idea of developing this project, this module, came to us quite a long time ago. But we found the software solution, the algorithmic solution, comparatively recently. And speaking about the design of today's lecture, our main task today is to understand the functionality of the microbiome module when used by specialists working with Veda Pulse, so that they can gain access to an indirect method which, based on autonomic dysfunction, can provide a preventive medicine specialist, a holistic practitioner, a nutritionist, a physician, with additional knowledge about a person's health in terms of the microbiome. Of course, let us say this directly at once, we cannot verify any specific strains using this type of analysis, but there are quite a few indirect methods of analysis. Such methods may include, for example, assessment based on exhaled gas, on certain spectra and spectral components associated with particular components of the microbiome. That is, we are not assessing the bacterium directly, but rather by indirect methods, by its metabolites. Traditionally, such methods include gas chromatography, mass spectrometry according to Osipov, when we use a gas analyzer to look at fatty acid metabolites in blood plasma, and in this way determine a quantitative probability, mathematically approximating this concentration to certain bacterial counts. And autonomic dysfunction may also belong to such methods, which we assess by cardiointervalography. A few words on this, because today we have an innovation. The audience includes not only specialists already working with Veda Pulse, but also those for whom this technology may be quite new. The Veda Pulse functional biohacking system is based on a method known in the expert community as heart rate variability. The essence of this method is that when calculating the duration of the cardiac cycle, which is classically analyzed through RR intervals, and you can see a screenshot of the interface of the software from the academic Veda Pulse module, it is calculated as vertical markers above the high amplitude peaks and, accordingly, as the distance in milliseconds. Below is a very interesting graph that shows how the duration of the cardiac cycle changes over time, according to the sequence of cardiointervals. That is why this graph is called cardiointervalography, and you can see how the duration of the cardiac cycle changes in the algorithm, and how wave-like it is. Accordingly, if we speak about the lower graph, about cardiointervalography, then from a mathematical point of view it is a periodogram that gives us an idea of all the regulatory influences present in the body that affect the so-called pacemaker cells, the rhythm drivers that ensure the electromechanical work of the heart from the standpoint of electrocardiography. This is the periodogram that we record. But speaking about this periodogram, we understand that the wave process of this graph actually reflects the totality of neuroimmune endocrine influences and the influence of various metabolites that can enter our body due to the phenomenon which we will discuss a bit later, bacterial endotoxemia. And by isolating a certain spectrum, which is what we do, using a fairly well-known mathematical method called the Fourier transform, which, incidentally, is widely used in neurology to analyze brain rhythms, when we understand that, say, at a frequency of 8 to 13 Hz, certain brain areas responsible for active wakefulness are working. At frequencies, say, from 13 to 18 Hz, that is already beta 1 and beta 2 rhythm, the brain areas responsible for active cognitive perception of the world are working, for solving complex intellectual tasks. In exactly the same way here, by decomposing it with Fourier spectral analysis, we obtain a very interesting graph of the wave structure of the rhythm, where frequency is plotted on the lower x-axis. And we see that peaks arise at certain frequencies. These peaks are related to the work of particular functional systems, but broadly speaking they reflect, so to speak, the autonomic regulation of the functions of that functional system. What is autonomic regulation of functions? For that, of course, we need to turn a little to physiology and say that the internal organs in our body are regulated by the so-called autonomic nervous system. In different traditions, if we take the Vedic tradition, This was called the Nadi channel system. If we speak about traditional Chinese medicine, it is the system of channels and meridians. But one way or another, this is linked, among other things, to nerve trunks, although, say, both the meridians and the Nadi channels may lie somewhat beyond our current perception of the material world. But returning to the autonomic nervous system, from the point of view of modern medical science, we say that it governs the unconscious regulation of the functions of the internal organs, including the contraction of smooth muscle elements, intestinal and gastrointestinal peristalsis, the secretion of digestive glands, endocrine secretion, and vascular tone at the level of blood vessels and lymphatic capillaries. And the main task of the autonomic nervous system is to maintain the stability of the internal environment, so that all necessary biochemical and physiological processes proceed within an optimal functional window, so that the body functions and responds to stress as adequately as possible. So, speaking of the autonomic nervous system, which we effectively scan through the method of cardiointervalography, we can very clearly see the balance between its divisions, the parasympathetic and sympathetic nervous systems. You can see that the parasympathetic nervous system controls the activity of the bronchopulmonary apparatus, causing the phenomenon of bronchoconstriction. It stimulates digestive secretion, stimulates bile flow, bile release, contraction of the bladder, and intestinal peristalsis, whereas the sympathetic division, on the contrary, relaxes the bronchial tree, increases the heart rate, and can slow down processes related to digestion, unlike the parasympathetic division, which stimulates them, and so on. That is, they work in a kind of counterbalancing state. But under certain conditions, this interaction between the two divisions, the sympathetic and parasympathetic, there is also a third division, the metasympathetic, which we will not go into. We will not delve that deeply into anatomy and physiology, but this balance begins to be disrupted. And a disturbance of this balance under certain processes is what specialists call autonomic dysfunction. That is, it is a certain complex of clinical and physiological, and the biochemical changes that follow, in the activity of organs and systems, which can lead to their impairment. The point is that the autonomic nervous system is a very sensitive barometer to everything. To anything unfavorable that may be happening in our body. Moreover, it reacts so quickly, and reacts first, that we may not yet even see the biochemical shifts that could already indicate the first signs of disease, and yet it is already signaling that there is a problem requiring a solution. And one of the processes to which the autonomic nervous system reacts, to which it responds with dysfunction, is the most insidious enemy of our body, the one that steals years of life and causes the development of most chronic diseases. This is the phenomenon of low-grade systemic chronic inflammation, which is also sometimes called metinflammation. At present, around metinflammation, there are phenotypes we still do not fully know, including in chronic diseases. In that sense, we still do not know everything that is going on. But a whole trail of serious fundamental research is being formed around this topic, because when we talk about healthy longevity, when we talk about issues related to extending lifespan, when we talk about health in terms of preventing the risks of various chronic diseases, and in general about anti-aging therapy, or, as Ayurveda calls it, Rasayana therapy, rejuvenating therapy, we understand, whether we realize it or not, that one of the major keys to solving these problems is control over the process of the low-grade systemic inflammatory response. The insidiousness of this enemy lies in the fact that, existing in our body for a long time, the body may no longer be able to control what is happening. In Ayurveda, this is called a disturbance of Vagni, a disturbance of tissue metabolism, which leads to further problems. It leads to 3 very serious ricochets for human health. And this does not happen in a day, a week, or even a month. This trend forms over years as serious risk to health. And the trend that we see is not imaginary. It is real. And this is precisely why low-grade inflammation is called a silent killer. It comes down to the following. First of all, at present, all issues related to the development of metabolic syndrome, dyslipidemia, insulin resistance, diabetes mellitus, and metabolic distortions in general, depend very strongly on the severity of this metinflammation, which, in turn, is projected onto chronic inflammation of adipose tissue in various organs with the subsequent development of fatty liver, insulin resistance, and, in essence, the classic development of metabolic syndrome. This is one of the main ricochets of low-grade inflammation. The second major ricochet lies in hormonal disruptions, especially in the female body, especially at the level of thyroid tissue, which is very sensitive to this low-grade inflammation, with the triggering of various autoimmune thyroid disorders and antibody titers in thyroid tissue, with hypofunction, and also with dysfunction at the level of the reproductive system with a strong trend toward hyperestrogenism, an increased, as it were. That is, a tendency toward a hyperproliferative response or tissue overgrowth, which in most cases is benign, but with a genetic predisposition may carry oncological risks. Therefore, the attention of clinician scientists to low-grade inflammation over the last few years, and to its projection onto various organs, neuroinflammation, low-grade inflammation in the skeletal system, low-grade inflammatory response in the endocrine system, and so on, has become very great. And when they began to sort out where this low-grade inflammation in our body comes from, it became clear that the immune system, being in a chronically irritated state, is constantly being fed by something. That is, something is constantly being thrown into the furnace of this low-grade inflammation, constantly feeding it. In clarifying this process, scientists came to the conclusion that the source of this low-grade inflammatory process is intestinal dysmicrobiocenosis, when at a certain stage the intestinal wall suddenly becomes permeable to bacterial endotoxins. And unfortunately, these bacterial endotoxins begin to trigger various chronic inflammatory diseases. There you have it. The thing is that under normal conditions the intestinal wall is, of course, permeable to hydrolysis products so that the body can receive nutrition, but it is not permeable to products of bacterial breakdown and bacterial endotoxins. Only in the case of dysbiosis, when the biofilm is disrupted and destroyed and the intestinal epithelial mucosal barrier is damaged, does the phenomenon of increased epithelial permeability arise, or what we call leaky gut, and, in essence, bacterial endotoxins entering our body begin to chronically irritate and excite the immune system. It, in turn, releases pro-inflammatory cytokines, and all of this begins to project, including as shown on this slide, onto chronic inflammation in adipose tissue and adipocyte cells, which, on the one hand, are fat cells, a depot of fat. They are also an endocrine organ that begins to produce a huge number of hormonal factors, sharply altering eating behavior, disrupting carbohydrate and fat metabolism, and, in fact, contributing to a shift toward the development of obesity, diabetes mellitus, and atherosclerosis. But then the question arises, how can we actually detect this low-grade inflammatory response? If you take the classic routine methods of inflammation testing, say, in large federal laboratory chains used by preventive physicians and nutritionists, biochemical markers such as highly sensitive C-reactive protein, highly sensitive markers such as ferritin, which often remains elevated in inflammatory processes, parameters such as erythrocyte sedimentation rate and fibrinogen, even if you measure one of these markers, you still may not find what you are looking for. If we do not measure the levels of the main pro-inflammatory cytokines that drive inflammation in our body and the classic sickness behavior during a cold, tumor necrosis factor, then its level in low-grade inflammation will remain within the upper reference range. Therefore, at the initial stages of the development of this low-grade inflammatory response in the body, biochemical markers are insensitive. But the inflammation is there, bacterial toxemia is there, and something needs to be done about it. And this turning point, this first pathological loop that actually forms a stable trend toward the development of this main enemy of our body, low-grade inflammation, is the phenomenon called metabolic endotoxemia. That is, increased epithelial permeability begins to let bacterial elements pass through, and this, conditionally speaking, poisons our body, triggering various chronic inflammatory diseases. Of course, the level of metabolic endotoxemia can be assessed indirectly. Federal research centers use such methods, for example, by measuring the concentration of lipopolysaccharides in blood plasma. But to say that this method is routine and a physician's practice, no. It is very expensive and used only occasionally in scientific research. And our research group, under my supervision, hypothesized that the autonomic nervous system may be very sensitive to the development of this low-grade systemic inflammation and may, long before obvious signs appear, provide preventive medicine specialists who work on healthy longevity with a tool for assessing these risks. Thus, in the Veda Pulse program we introduced an index called the inflammation threshold, which has several ranges and quite clearly indicates that the autonomic nervous system is responding with dysfunction to this low-grade inflammation and bacterial endotoxemia. If this index is in the green zone, we say that the anti-inflammatory antioxidant system is suppressing this low-grade inflammation effectively enough, buffering it, and everything is under control. The detoxification system is effectively eliminating metabolic endotoxemia. But if this index moves into the yellow zone, then this index is already showing the specialist that this insidious enemy is present in the body of the client or patient. And it is impossible not to take this factor into account, because even a simple correction of a nutrient deficiency, for example, vitamin D in high doses, will not produce a significant restoration of the level of this vitamin or of other nutritional deficiencies against the background of this low-grade inflammation. Therefore, in complex, personalized, individual programs and rehabilitation protocols, you need to take this position into account, and not leave out anything that will act on this process. Whether you do it consciously or unconsciously, you affect it one way or another. Of course, it would be better if you did so consciously. At the same time, it is precisely in the yellow zone that biochemical markers are not yet sensitive. But in the autonomic nervous system, this index already shows you that it is there. This inflammation is present, and it needs to be addressed. If this index enters the orange-red zone, then here, yes, you can, so to speak. As I say, put on Nostradamus's hat. And you can safely say that, most likely, in biochemical blood tests you will already catch those inflammatory markers we listed. And moving on, we also tried to understand whether autonomic dysfunction can respond to the degree of bacterial endotoxemia. That is, to the fuel that keeps this inflammatory process going. What, as a result of increased intestinal epithelial permeability, gets inside our body and maintains this metinflammation? Accordingly, we developed an index, as we called it, the metabolic stress level, which quite clearly, in plain language, shows how to explain it to an ordinary person, the degree of your internal toxic burden, but in essence the severity of bacterial endotoxemia associated with increased epithelial permeability. If a person is in the yellow zone, that is it, epithelial permeability is increased, the intestine is already leaking and is already causing this low-grade inflammation through products of bacterial breakdown. But if this index is in the orange-red zone, then one can speak of leaky gut syndrome, as we usually use the term. And here, of course, this bacterial endotoxemia already creates strain on the detoxification systems. Most likely, in the biochemical blood test of such a patient, ALT and AST transaminases will be elevated, showing strain of function, and so on. This is, of course, evidence of hepatic detox strain, that the liver is trying to fight this elevated level of bacterial endotoxins and is under load. And, most likely, biochemical shifts will move toward an increase in the HOMA index, reflecting the state of insulin resistance, an increase in triglyceride levels and, in general, a trend toward dyslipidemia and elevated cholesterol levels, which, in general, are the initial steps in the development of metabolic syndrome. Thus, into the hands of specialists who work with the functional biohacking system, we have given two unique indices which truly, within preventive medicine, at the level of sanatorium resort facilities and medical centers, health offices, and private practice of specialists in nutrition and preventive medicine, as well as the private practice of holistic practitioners, provide an outstanding assessment tool through autonomic dysfunction for this insidious enemy, low-grade metinflammation. This enemy is insidious also because it triggers a complex restructuring of our processes. And at the final stages it can lead to the so-called hypometabolic type, associated with a pronounced disturbance of Vagni, as Ayurveda says, and the development of a tendency toward chronic fatigue syndrome as a result of mitochondrial dysfunction. And ultimately, another index that speaks to functional reserves, an index that reflects adaptive potential, or, in simpler words for a person, the level of life energy, shows you how capable the body is of coping with this low-grade inflammation without collapsing into energy deficiency. And, of course, metabolic stress itself, low-grade inflammation, and the autonomic dysfunction that responds to them, lead to the development of marked strain, which we call stress strain. And again, we say that functional biohacking, through the Veda Pulse Stress Index, allows us to see this. When you see that this index has moved into the yellow zone, into a state of compensated distress, the strain and autonomic dysfunction are already quite pronounced, but the body still has the resources to compensate. But this already requires the prescription of autonomic regulators, comprehensive correction protocols, stress-limiting therapy is already required, including the use of herbal tranquilizers and so on. But if this index enters the red zone, the oxidative stage of stress, then we say that, of course, stress begins to cause the development of the diseases of civilization. Because it is not stress itself that damages our body, what damages us is the excessive activity of stress-activating systems, which include the sympathoadrenal system, and it drives the stress response, which causes one of the main diseases of civilization, hypertension due to vasoconstriction and increased vascular tone of smooth muscle elements. The stress-realizing systems also include the glucocorticoid system, which under normal conditions should have anti-inflammatory activity. But its excessive persistence causes complex changes in fat and carbohydrate metabolism, immunodepression with reduced autoimmune control and oncologic alertness. And the stress-realizing systems also include the so-called somatomidine system in the liver, which under conditions of fatty hepatosis triggers the second pathological loop of insulin resistance associated with insulin-like growth factors and decreased tissue sensitivity to insulin. And when this index is in the red zone, we understand that this oxidative stage of stress causes chronic activation of these stress-realizing systems. And the person is simply taking giant steps toward the development of these diseases, which accordingly gives us an understanding of the need for additional individualized, personalized recommendations that we must include in the protocol. Thus, we can say that this low-grade inflammation, supported by metabolic toxemia and associated with an imbalance of apana vayu in the large intestine, as an Ayurvedic medicine specialist would say, or associated with dysmicrobiocenosis, as a specialist as a preventive medicine specialist would say from the standpoint of modern concepts. This low-grade inflammation begins to project into various functional systems. And with the help of frequency analysis of autonomic dysfunction and metaspectral assessment of cardiointervalography, we can see which functional system this low-grade inflammation begins to move into, where it begins to tear the delicate fabric of the living functional process. Thus, we can say that this low-grade inflammation, supported by metabolic toxemia and associated with an imbalance of apana vayu in the large intestine, as an Ayurvedic medicine specialist would say, or associated with dysmicrobiocenosis, as a specialist as a preventive medicine specialist would say from the standpoint of modern concepts. This low-grade inflammation begins to project into various functional systems. And with the help of frequency analysis of autonomic dysfunction and metaspectral assessment of cardiointervalography, we can see which functional system this low-grade inflammation begins to move into, where it begins to tear the delicate fabric of the living functional process. And so, friends, after a small half-hour lyrical introduction, we have arrived at the main topic, the microbiome module. At the moment, for functional biohacking this is probably the peak of its development, if we speak about the method. And here if we speak about the mathematical algorithms, it is a kind of layered cake of mathematical formulas that allowed us to form certain rating scales for microbiome disturbances in the main biotopes of the body. Let us take a closer look at how this module is structured. First of all, speaking about the sections of the module, we have quantitative scales showing the degree of microbiome imbalance in a given biotope. A biotope is the location of the microbiome. The main biotope of our body is, of course, the intestinal one. The bacterial mass there is enormous, measured in billions, up to 2 to 3 kilograms. But we have other biotopes as well, and we will talk about them too. If we speak about the gastrointestinal biotope, separately we were able to distinguish a scale based on autonomic dysfunction associated with the response to bacterial endotoxemia, biofilm status, and alpha diversity in the stomach, with an additional risk of Helicobacter contamination. First of all, speaking about the sections of the module, we have quantitative scales showing the degree of microbiome imbalance in a given biotope. A biotope is the location of the microbiome. The main biotope of our body is, of course, the intestinal one. The bacterial mass there is enormous, measured in billions, up to 2 to 3 kilograms. But we have other biotopes as well, and we will talk about them too. If we speak about the gastrointestinal biotope, Separately, we were able to distinguish a scale based on autonomic dysfunction associated with the response to bacterial endotoxemia, biofilm status, and alpha diversity in the stomach, with an additional risk of Helicobacter contamination. In the classical sense, if we speak about the upper and lower airways, we also have a separate scale for the genital microbiome, where in women we assess the risks of disturbance of the vaginal biotope, and in men, of the urethral biotope. We also have a separate scale in this module for the urological microbiome, because we say that chronic cystitis is a full-blown dysbiosis of the distal urinary tract, and without resolving it and restoring the biofilm, we will never solve this situation. And, of course, we singled out the skin biotope, because quite recently, friends, we also had the release of the cosmetology module, where we had already partially implemented this situation. In the classical sense, if we speak about the upper and lower airways, we also have a separate scale for the genital microbiome, where in women we assess the risks of disturbance of the vaginal biotope, and in men, of the urethral biotope. We also have a separate scale in this module for the urological microbiome, because we say that chronic cystitis is a full-blown dysbiosis of the distal urinary tract, and without resolving it and restoring the biofilm, we will never solve this situation. And, of course, we singled out the skin biotope, because quite recently, friends, we also had the release of the cosmetology module, where we had already partially implemented this situation. Then we give you, as a specialist, a prompt that if the indirect method of functional testing, speaking about Veda Pulse, provides only a probabilistic model, and you want to deepen your knowledge further in the field of microbiome diagnostics, then there is a large block on laboratory microbiome assessment in a specific biotope, where we describe in detail what types of tests you can recommend to a person in order to deepen your understanding of the disturbance of this microbiome in that area. And perhaps the most important thing in each module section is the correction program. There are 3 of them. If we see that there are no obvious disturbances, we provide a brief preventive regimen that you can address to your patient or client. If there are minor disturbances, we recommend a certain therapeutic regimen that you can use. And, of course, this regimen consists not only of prescribing biotic products, but also of dietary recommendations, which must also serve as a foundation if we are carrying out eradication therapy of pathobionts, if we are restoring the metabolic core of normobionts or the structural core of normobionts. We explain all of this to you in detail. Well, let us get into the details. Now come the details. So, in the microbiome module, a whole section is devoted to the gastrointestinal biotope. The fact is that classically, if we speak about the gastrointestinal tract, beneficial bacteria are found not only in the large intestine, where, of course, their concentration reaches very high values, up to 10 to the 12th power, but the bacterial mass gradually increases in the most distal direction from the initial sections of the small intestine toward the terminal sections, where it passes into the large intestine. But even the stomach today is no longer considered a sterile ecological niche. It also has its own biofilm, up to 57 different bacterial genera, which is called alpha diversity. If this is disturbed, especially in association with Helicobacter infection, of course this problem may lead to impaired stomach function. And here there is a scale, a vertical scale, a 12-hour dial. This is precisely the large intestinal biotope. And you can see that the program, having detected indirect signs of autonomic dysfunction associated with disturbance of this biotope, will give you prompts in the form of probable clinical signs that this person may have, so that you can conduct a more detailed clinical interview, a survey, and ask these questions. Do you have signs of gastrointestinal dyspepsia such as abdominal bloating and flatulence? Are there disturbances in bowel habits? Changes in stool frequency, a tendency toward constipation, diarrhea, stool consistency, and various other points, which can clearly, clinically indicate the presence of dysmicrobiocenosis. If significant signs of disturbance arise, then of course the program will suggest more serious symptoms. This is a prompt for you as a specialist, so that, seeing these signs, you can be even more confident that we are dealing with dysbiosis in this biotope. And then, as I have already said, Veda Pulse, as a functional biohacking system, will, if necessary and if desired, offer you the possibility to verify these indirect signs identified by the biohacking method by direct methods of assessing the disturbances that accompany dysbiosis, particularly in the large intestine. It will suggest what you can recommend that the patient do within the program. A bacteriological stool culture can be done, but today the most popular, highly sensitive, and highly reliable method that has entered clinical practice is PCR analysis for dysbiosis, as well as additional methods in cases where symptoms associated with inflammatory phenomena in the gastrointestinal tract have already arisen. This includes fecal occult blood testing and fecal protein testing. This also includes testing for fecal zonulin and, if necessary, testing for protozoal infection. That is, the program prompts you with all of this, and it is then your decision whether or not to recommend a deeper follow-up analysis, in the form of a laboratory checkup that you can offer to your patient. Accordingly, moving further through this module, through this large intestinal biotope, we see that once the program identifies disturbances, it will give you recommendations that you can then pass on to the patient, that in order to prevent dysbiosis, certain lifestyle changes need to be made, in physical activity, hydration, diet, biorhythm regulation, and so on, all of which in one way or another will, of course, positively support the normal state of the microbiome, if we are talking about prevention. If a minor or significant disturbance arises, the program will then suggest more serious recommendations which you will give to your patient. Moreover, all of this is generated in a text conclusion. The module provides a detailed written conclusion after the analysis, on what needs to be balanced in the diet, what to enrich it with, what to exclude, and what must definitely be included, and also, for example, which useful herbal decoctions might be used, so that these initially minor microbiome disturbances are not allowed to progress to a leaky gut situation, which will trigger what we discussed in the first part of the lecture, all these serious disorders and, most importantly, the development of the insidious enemy of low-grade inflammation, which steals years of life. The program will also prompt you on what should be increased in the diet, since these sources of biotic support are necessary factors for correcting functional dysbiosis at the level of short-chain fatty acids, and what should be excluded, since these products will intensify fermentation, increase putrefaction, increase the feeding of pathogenic microflora and, accordingly, interfere with the process of restoring your client's health. And if we speak about recommendations, the program will also recommend products from the Wellness Biotica line, in this case. And ultimately, here is a regimen that has been worked out clinically for IBS. The first part of this slide is IBS with diarrhea predominance. This regimen works well. The second is IBS with constipation predominance. You can take it into practice, but, repeating, the module will prescribe all of this for you. And you can work with it. We move on to the next biotope, the small intestinal biotope, the next scale on the dial, somewhere between 1 and 2 o'clock, and we can see that here too both minor and significant changes are possible. Of course, given that this biotope differs in bacterial mass and other features, the program will, if necessary, prompt you on what additional laboratory checkup can be recommended for your client patient in order to confirm your hypothesis, derived by the indirect method of functional biohacking, about microbiome disturbances. The gastric biotope and Helicobacter. A very important biotope. Because contamination, that is, infection with Helicobacter, in the world's population is enormous, but fortunately there are not so many pathogenic highly virulent strains that lead to metaplasia. In any case, the danger of Helicobacter in women also lies in the fact that through antigenic mimicry it can increase the risks of mastopathy and raise the inflammatory response in thyroid tissue. That is, for example, autoimmune thyroiditis in the presence of Helicobacter proceeds much more aggressively, while in men the probability of developing chronic pancreatitis against the background of persistent Helicobacter infection is also many times higher. Therefore, analyzing the risks of gastric microbiome disturbance and the risk of developing Helicobacter infection is, of course, an important functional checkup, so that it becomes possible to prevent the serious risks carried by this infection. The program will again prompt you, friends, with what symptoms disturbance of the microbiome in this biotope may be associated: pain in certain locations, the same symptoms of gastrointestinal dyspepsia, and certain biorhythm and clinical signs that with high probability point to problems of dysbiosis specifically in this section of the gastrointestinal tract. The program will also show what specific types of analyses we need and would like to perform if we are speaking of a direct assessment of this biotope. Here you can see the urease test, the assessment of plasma antibodies to Helicobacter, and direct stool biomaterial testing for Helicobacter antigens. Which depends on what region you live in, how available laboratory diagnostics are there, and what can be recommended. Of course, speaking about Helicobacter therapy, we must say that highly virulent pathogenic strains should be treated with triple or quadruple therapy. But the problem with this academic approach is that by suppressing the growth of this spirochete, though in fact it is a flagellated bacterium, a distant relative of the bacterium that causes the disease of pleasure, as I always say, this bacterium is insidious because when it converts into a coccoid form, even quadruple therapy cannot reach it. And there are many relapses after this therapy. And the consequences of quadruple therapy are also significant. And one of those key consequences being discussed in the professional community today is that 3 to 6 months after antibiotic therapy for Helicobacter, a person often begins to put on weight quite noticeably. They start gaining body mass due to a serious distortion in the metabolic core of normobionts caused by the impact of these antibiotics, with the risk of developing metabolic syndrome. The Veda Pulse program, as a functional biohacking system, will highlight the Helicobacter pylori eradication program for you, and it will suggest the dose, frequency, and certain types of metabiotics, taking into account sex and age characteristics, as well as certain functional deviations. And Veda Pulse sees this so as to approach the correction of this condition as personally as possible. The respiratory tract biotope is very relevant in childhood, very relevant during the runny nose cold season, when the viral load rises sharply. And, of course, the microbial topography of the airways is very complex. The old hypothesis that the lungs should be sterile has long been left in the past. There is its own very complex biofilm there. Unlike the intestine, this respiratory microbiome, this section of the microbiome, is exposed to somewhat different biophysical factors. And accordingly, the formation of the nasopharyngeal microbiome in childhood determines high risks of bronchial atopy already in adulthood. And all children with adenoids are children with full-blown nasopharyngeal dysbiosis, just like all children and adults with chronic tonsillitis. These are people with full-blown dysbiosis of the oropharynx and oral cavity. And, of course, when we speak about the upper and lower respiratory tract, there are their own patterns there. When speaking about the respiratory biotope, we need to remember that there is a so-called gut microbiota lung axis. This axis has very tangible functional connections between the intestine and the lungs. In fact, I am always surprised and say that in traditional Chinese medicine the lung channel and the large intestine channel are paired channels. They interact very strongly with each other from the standpoint of pathology development. This is confirmed, among other things, by the recently discovered microbiome connection between these two biotopes. And here are the signs of respiratory microbiome disturbance in the form of probable risks according to autonomic dysfunction and metabolic endotoxemia. The functional biohacking system will prompt you and suggest what clinically associated manifestations this person may be experiencing. Here you will see, if we speak about the microbiome of the mouth and nasopharynx, that there may be various signs. And you as specialists should, of course, know and understand these clinical signs. The program will prompt you about them. Just as with other biotopes, Veda Pulse will prescribe recommended laboratory methods for assessing the respiratory microbiome. If we are talking about severe damage to it, more serious approaches to restoration are already required. And, of course, the program will personalize the selection of certain components of biotic therapy. And here is a classic basic correction program regimen, which Veda Pulse, taking into account body weight, age, certain features, functional deviations, sex, will compile as personally as possible for the specific person being examined, and then with your own modifications you can recommend this program. The Skin Microbiome Scale. The skin as an organ, of course, has its own biofilm, and its own so-called core composition, as experts call it. Accordingly, the nourishment for this biofilm is the secretion of sweat and sebaceous glands, which secrete not only antimicrobial peptides that help maintain the microbiome, but also primarily protecting us from pathogenic fungi, viruses, and bacteria, while also releasing lipids necessary for the energy supply of beneficial bacteria, so that this whole composition maintains the necessary pH and growth of this biofilm. And when this is disturbed, the disturbance is very often associated with intestinal disorders, and here a new axis arises, the gut axis, or, as Ayurveda says, apana vayu, and the skin microbiome, or, as Ayurveda says, Brajaka Pitta, and accordingly this interconnection exists very closely. This is seen very clearly, for example, in classic microbiome disturbances such as atopic dermatitis, eczema, and so on, when the inflammatory process in the intestine, having broken through into the body, causes inflammation in the skin, full-blown dysbiosis, and as a consequence supports the development of pathobionts with a powerful pro-inflammatory potential. Therefore, the program will prompt you on the signs of disturbance of this skin microbiome. Let me jump a little ahead and say that this scale is identical to the scale in the cosmetology module and is calculated by the same algorithm. It will prompt you on the symptoms that disturbance of the microbiome in this biotope may produce in the form of itching, redness, peeling, the appearance of rash, unpleasant odor, exacerbation of existing chronic diseases, all of which you will explore when interviewing the person. And, of course, if there is a need to deepen the understanding of microbiome disturbance in this biotope, the necessary laboratory correct analyses that can be recommended as part of a laboratory checkup. Here you can see how the skin microbiome restoration program is prescribed, and again the Veda Pulse device and program algorithms personalize this program as much as possible based on all incoming data that Veda Pulse receives. By the way, literally in March, friends, we introduced a new product, a serum called Vetobiomica, a registered trade name, which allows us to use bacterial lysates and metabiotics externally to restore the microbiome in various skin diseases. I will say at once that this is a therapeutic serum, that is, it is not merely cosmetic, though it does have a pronounced anti-aging effect. This serum contains lysates that we obtain from lysis of 24 normobiome strains, and certain phytocomponents with direct action on skin inflammation. Also important elements, a very high concentration of retinols, a very high concentration of tocopherols, sodium hyaluronate, and dexpanthenol, which are, of course, epithelial restoring, moisturizing, and regenerating factors under erosive inflammatory conditions and help the skin recover faster. Therefore, to the skin microbiome restoration program we now definitely recommend adding the serum. You can see that its direct indication is various diseases. And it is currently being used quite effectively by clinicians in dermatology. The urological microbiome scale, the urological biotope. As I already told you, urethritis and cystitis are not just inflammatory diseases, they are inflammatory diseases associated with serious dysbiosis in this section of the mucosa. Accordingly, the program will prompt you on which clinical signs such as low back pain, dysuric disorders, low-grade fever, the appearance of swelling and so on, may be associated with these signs of dysbiosis. You will ask your patient about all of this in the interview, and it will suggest the necessary laboratory tests for assessing the state of the urological microbiome by classical laboratory diagnostics, if needed. We have developed a clinically tested good program for restoring the urological microbiome, where we have a high eradication potential, especially in Escherichia coli infection, where we have good antiseptic potential and a mild diuretic effect. And this program is effectively used not only for inflammatory kidney diseases, but also for urolithiasis, cystitis, and urethritis. Here you can see this regimen. We perform eradication and relieve urological inflammatory symptoms. It works excellently in this regard. This was shown in 2 clinical studies on recurrent cystitis in women, and in endoscopic stone removal for urolithiasis, where we reduced the period of inpatient observation from 7 days to 3 because our program was good at interrupting postoperative inflammatory manifestations. Therefore, you can use this program. And now we move on to the genital microbiome. A very complex biotope, especially in women, a hormone-dependent biotope. And the idea that this biotope is formed exclusively thanks to Lactobacillus acidophilus, unfortunately, has already been left in the last century. We understand that the composition of the microbiome is very complex. Several dozen lactobacilli have been identified. And unfortunately, Acidophilus is not the dominant species. We will discuss all of this with you at the school. We will talk about different types of the vaginal microbiome. Which of these types are pathological, which types are normal or covertly pathological, and what needs to be done about it. And here are the signs of genital microbiome disturbance through autonomic dysfunction. Using the method of functional biohacking, by an indirect method, we can assess this. Accordingly, the program will again prompt you regarding the clinical signs that may be associated with dysbiosis disturbance in this biotope. The program will tell you which laboratory methods of analysis need to be additionally prescribed if you see the clinical signs. And this will deepen your understanding of the structural disturbance of the biotope. We have unique specially developed programs for restoring the female microbiome. Please note, if a woman, having caught a cold, had to take antibiotics for 3 to 5 days, for example because of a concurrent sore throat, then, a week after taking antibiotics, not only may the normal function of the gastrointestinal system be disturbed, through the direct impact of the antibiotic on the GI microbiome, but chronic cystitis may also flare up due to microbiome disturbance in the distal sections of the urinary tract, and she may develop thrush or bacterial vaginitis as a manifestation of genital microbiome disturbance. Therefore, this program works across 3 biotopes at once: the gastrointestinal biotope with Herbalysate Gastro, the urological biotope, and the genital microbiome with Herbalysate Female. Accordingly, the program will select this Herbalysates regimen for you in detail. It will give you the necessary doses, recommendations, and intake regimens, intensive or preventive, depending on how pronounced the disturbance is according to the autonomic dysfunction data, and these protocols, of course, you may modify in the conclusion according to your own view of the problem, if necessary. There is a similar program for restoring the male microbiome, which works simultaneously in the intestinal biotope with Herbalysate Gastro and at the level of the genital and urological microbiome. Since in men, too, after taking antibiotics there are not only signs of gastrointestinal dyspepsia, but male health problems can also flare up quite seriously. This comprehensive program will allow you, if you consult men on Veda Pulse, to take a more personalized approach to recommendations. The basic recommendation scheme is before you. It is a complex scheme. As a rule, we prescribe it for at least a month, preferably in quarterly courses. The program also takes this into account. In case of significant disturbances, it will offer you this quarterly regimen, that is, for 3 months, and will describe the necessary therapy in detail in the conclusion. The scale of the biotope associated with protozoal infection. Of course, let us say honestly, we do not verify the type of parasite. It would be naive to assume that. We only look at the severity of autonomic dysfunction that may be associated with the risk or probability of protozoal infection. Accordingly, the program will again prompt you regarding signs of this protozoal infection in the form of allergies and other problems that may arise and be a hidden manifestation of protozoal infection. If necessary, the program will describe in detail what types of parasite tests, in this case gastrointestinal parasites, can be recommended additionally for the client. One of these, as I have already said, is the test for protozoal infection. And we have an excellent antiparasitic program that, in an environmentally gentle way, using natural factors, highly concentrated bitters, and above all our innovation in the form of bacterial lysates and a high concentration of bacteriocins and antioxidants, helps the body cope with this serious problem. The antiparasitic program regimens vary. Veda Pulse will, of course, select this regimen taking into account age, sex, body weight, and the accompanying factors available in Veda Pulse, and will suggest a personalized program for you. And in conclusion of the lecture, I would like to say, in the words of our Nobel laureate Ilya Mechnikov, that a person can live more than 150 years. He said this 100 years ago when receiving the Nobel Prize. If they take the putrefaction processes in the intestine under control, the imbalance of apana vayu spoken of by Ayurveda, and the problems associated with bacterial endotoxemia spoken of by modern medicine, this is exactly what the Wellness Biotica Project and Veda Pulse are now working with, giving you the opportunity not only to assess it, but also to correct it. They provide excellent correction options to take these putrefactive processes in the intestine under control and truly engage in real anti-aging therapy. The Veda Pulse Functional Biohacking Project has its own social accounts where we publish a lot of information. We will be glad if you become friends with us on these social accounts. If you would like to work with the functional biohacking system, friends, We will be glad. I thank you for your thirst for knowledge, because it is precisely thanks to it that you develop as specialists. And our projects, Veda Education, Wellness Biotica, on the microbiome, and Veda Pulse, on biohacking, will be glad to be your assistants in developing your professional competencies. See you on the air. All the best to you.